Hello, and welcome to Personal Safety and De-Escalation for Home Health Workers. My name is Stephanie Smith, and I'm with Imagine Health. I'm excited to be here with you today. I'm a licensed clinical social worker with a master's in social work, and I hold certifications as an advanced social work case manager and an advanced social worker in gerontology. Over the past 15 years, I've worked across the full spectrum of social work and behavioral health, from residential treatment and child welfare to hospital-based social work and long-term care consulting. A big part of my work has involved home visits, whether that's providing care coordination, assessments, or crisis response in the field. What I've learned along the way is that home visits bring a unique risk. You're walking into someone's space, often with a little backup, and you have to balance compassion with awareness. That's where de-escalation skills really come in, not just techniques, but as a part of how we think, communicate, and keep ourselves and our clients safe. Today's training is all about the intersection, blending of practical safety with trauma-informed person-centered care. I hope by the end of our time together, you'll feel more confident, more prepared, and more supported in the incredible work that you do. Now, before we dive into content, I want to take a moment to share the 3 core goals of today's training. Stay safe, prevent escalation, and respond effectively. First, when we talk about staying safe, we mean both physical and psychological safety. That includes identifying common risks you might encounter in the field, preparing yourself before each home visit, and making sure your safety is never compromised in the process of providing care. Second, we want to prevent escalation whenever possible. That means knowing how to recognize early warning signs, whether it's a client's behavior, body language, or home environment, and using calm, respectful communication to keep things from becoming tense. Setting clear expectations and boundaries from the beginning of a visit goes a long way. And third, we'll focus on responding effectively if a situation does begin to escalate. This is where de-escalation skills really matter. Things like maintaining a calm presence, choosing your words intentionally, and knowing when to pause, redirect, or even leave a situation. We'll also cover what to do in an emergency and how to document and follow up afterwards. By the end of today's session, you'll walk away with strategies you can use right away in the field, no matter what kind of home or client situation you're walking into. To start, home visits are an incredible service for folks who are homebound or have other barriers that prevent them from accessing support outside of their home. With that being said, providers that serve people in their homes can have a unique set of challenges. Some of the biggest realities of home visits is that there is a level of isolation, unpredictability, lack of control, and a high emotional load. Unlike working in a clinic or a hospital, when you're out in the field, you're typically alone. There's no security guard down the hall, no coworker nearby to ask for backup, and if something starts to feel unsafe, the response time is entirely dependent on you and your plan. That's why preparing ahead and trusting your instincts are so important. With the unpredictability, you never fully know what you're walking into. Even if you've seen the client before, things can change fast. Maybe there's a new person in the home, or the client is in crisis, or someone is under the influence, or that the environment feels more chaotic than usual. It's kind of a moving target. You don't always have control over the space, and this isn't a controlled office setting with a panic button or policies around sharp objects or weapons or animals. You're entering their space, and with that comes fewer built-in safety nets. But it doesn't mean you're unprotected. It just means that you have to use preparation, awareness, and boundaries as a protection tool. And on top of that, remember that home workers carry a huge emotional load because many of our clients are dealing with a high emotional load with medical stress, trauma, frustrations with the system they've encountered. These feelings sometimes come out in ways that feel personal, even when they're not. And that's where our ability to stay grounded and calm really makes a difference. This type of work asks a lot from us. To be compassionate, alert, and ready to adapt, but it also gives us an opportunity to practice and strengthen our safety skills in meaningful ways. When we talk about safety during home visits, these are some of the most common concerns we face, and being aware of them ahead of time can make all the difference. Let's start with verbal threats and abuse. This can include hostile language, yelling, or direct threats. Sometimes it comes from the client, but it can also come from family members or others in the home. Often these behaviors are rooted in stress, trauma, or a sense of loss of control. But no matter the cause, we need to take verbal aggression seriously and know how to respond to it. Next is physical aggression. This might look like someone hitting, pushing, slamming doors, or even blocking you from leaving. Sometimes it escalates from agitation, so it's important to watch for warning signs like pacing, clenched fists, or raised voices. Recognizing these behaviors early gives us a chance to pause, de-escalate, or leave if needed. And finally, we need to be alert to unsafe environments. That could mean visible weapons, aggressive or unrestrained animals, or signs of substance use like drug paraphernalia. Environmental hazards matter too. Things like poor lighting, clutter that blocks exits, or unstable flooring can create safety risks, especially if you need to leave quickly. The goal isn't to assume the worst about every situation, but to enter each home visit with awareness, preparation, and the tools to protect yourself if something doesn't feel right. Now let's transition to pre-visit preparation. Before we ever step foot in someone's home, the safest thing we can do is prepare and start with knowing who and what we might encounter. The first thing I look at is previous aggression. Has the client ever made verbal threats or acted physically towards staff? Has there ever been a situation where tension escalated quickly? Sometimes there might even be a history of law enforcement being called to the home. None of this means the client will behave that way again, but it helps us to stay alert and ready. Next, we think about environmental red flags. That could mean knowing there are weapons in the home or that a client has an aggressive pet that's not always secured. It could also be reports of unsafe living conditions. Maybe the home is cluttered, dark, or has hazards that make it hard to leave quickly. And we can't forget about other people who might be there. Sometimes it's a visitor, not the client, who poses the risk. And finally, we always look for recent changes or stressors. Maybe the client just lost a loved one or had a major health crisis or has new people living in the home. Maybe there's been a big shift in their mental health or substance use. Those changes can affect how they respond to us. As workers working in people's homes, we juggle a lot, caring for clients, managing schedules, and navigating different environments every day. But before we walk through any door, there are a few safety steps we can take that make a huge difference. First, schedule wisely. If you can plan a visit during daylight hours, not only is it easier to see your surroundings, but it also reduces the risk of being in an unfamiliar neighborhood after dark. Next, know the environment. Ask ahead about pets, especially large or protective dogs, and make sure they're secured before you arrive. Also, get familiar with where you'll be parking, whether the area is well lit, and if there's a clear path from your car to the home. You can do this through like Google Maps or anything like that. When it comes to what you bring, travel light. Bring only what you need for the visit. Keep cash and valuables to a minimum, and avoid carrying equipment that might slow you down or attract attention unless necessary. Prepare your gear ahead of time. That means a fully charged phone and any personal safety tools you prefer, like a whistle, personal alarm, a safety app, and your car keys and ID where you can reach them quickly. And always have a plan. Park your vehicle so you can drive straight out without having to back up when possible. Notice any safe public places nearby, like a store or a cafe, where you could go if you feel uncomfortable. Keep your supervisor and emergency contact numbers handy in case you need support right away. The goal isn't to make you fearful, it's to make sure that you're confident. When you're prepared, you can give your full attention to your client while still being aware of your own safety. Now, working alone in the field doesn't mean that you should feel alone. That's where a strong communication plan comes in. It's like having a safety net wherever you go. While these recommendations are not standard protocol across agencies, these are some of the best practices that I've encountered and I've used along the way. First, have a check-in, check-out system with someone you trust, whether it's a supervisor, a coworker, or a lead. Let them know when you arrive and when you leave, and agree on a simple code word or phrase that you can use if you're in trouble and can't speak freely. Share your itinerary ahead of time and keep your professional calendar up to date. Make sure you have it shared with your supervisor or lead. Include the who, the what, the where, the when. If something changes during the day, make sure to update it. It might seem small, but it makes a big difference if someone needs to find you quickly. Also, take advantage of safety technology. You can use GPS location sharing through a secure app or even a discrete safety app that alerts someone if you press a button. Just be sure to test it before you need it so you know how it works under pressure. And finally, have clear response protocols. Your contact should know exactly what to do if you don't check in, and you should know exactly how to trigger help if you need it. This isn't about creating extra work, it's about creating peace of mind. Knowing that someone is watching out for you allows you to focus fully on your client without that nagging feeling of what if. So now we're going to transition to situational awareness. When we talk about situational awareness, the first thing to think about is how you would leave if you needed to. Before you sit down, take a moment to spot at least two ways out, your main exit and a backup. That might sound overly cautious, but if a situation turns, you'll be glad you mapped it out first. Once you know your exits, position yourself so that you can see your way out clearly, and try to avoid sitting somewhere where you would have to squeeze past someone to leave. As you settle in, scan for environmental hazards. Is the floor cluttered? Is there a loose carpet or an unstable step? If you had to move quickly, those little things could slow you down. Also, pay attention to anything that could pose a more immediate threat, like a weapon in plain sight, an aggressive animal that's not secured, or signs that someone is using substances in the home. And finally, keep your essentials, like your car keys and your phone, somewhere you can grab them instantly. The last thing you want to do is dig through your bag if you need to leave in a hurry. The second piece of situational awareness is tuning into the human side, the client's behavior and tone. Start with their voice. Is it getting louder, faster, sharper as you talk? Changes in speech can be an early sign of stress or agitation. Then, look at their body language. Are they pacing the room, clenching their fists, turning away from you, or suddenly avoiding eye contact? These physical signs can tell you a lot about how the person is feeling, even if their words say something different. Facial expressions can be just as telling. Sometimes you'll see frustration, fear, or anger in the face before they even say a word. It's important to remember that escalation isn't instant. Sometimes tension builds slowly and the client's tone shifts little by little, or they become more restless as the visit goes on. And keep an eye out on the dynamics with anyone else in the home. The client may be calm, but another person in the room might not be, and those interactions can change the energy quickly. The more tuned in you are, the sooner you can respond in a way that keeps the visit safe and productive. The last piece of situational awareness is about keeping yourself alert and centered. First, be intentional about where you sit or stand. Position yourself so that you can see the entire room and keep your exit in sight. This not only helps you react quickly if needed, but also gives you a subtle sense of control in the space. Limit your distractions. I know our phones are important, especially for safety, but if you're constantly looking down at your screen, you're missing the changes in the room. Keep it accessible, but not in your hands unless you need it. Your body language matters too. Standing or sitting with calm, confident posture communicates that you're professional and in control. People often match energies that you project, so staying grounded helps the whole visit feel calmer. If a situation starts to feel tense, use a grounding technique like slow, deep breathing or adjust your stance to feel more comfortable and stable. These small actions help you stay clear-headed and avoid reacting impulsively. And finally, trust your instincts. If something feels off, don't ignore that feeling. It's perfectly okay to pause, reassess, or even decide to leave if that's the safest choice. Your safety always comes first. All right, now let's transition to one of my favorite areas and what I think is probably the most underrated is escalation prevention. One of the best ways to prevent escalation is to set the tone right from the start, and that begins with respect. When you arrive, greet your client warmly and use their preferred name. That small act builds trust and signals that you see them as a person and not just a client or a case. Always ask permission before moving personal items or entering another room. Remember, we are guests in their space, and treating it with respect shows that we value their comfort and autonomy. It's also important to be mindful of cultural norms and household dynamics. A gesture or behavior that seems routine to you might feel intrusive or disrespectful to somebody else. One thing that I always like to do is ask about shoes in a household because some clients are very particular about shoes being outside the home and not inside the home. And so it's just a nice way to start off the conversation and respect what they do in their home. Now, when your client is speaking, use active listening, which means giving them your full attention, letting them finish, and responding in a way that shows that you heard them. Even if you don't agree with their point of view, you can still acknowledge their feelings. And finally, keep your tone calm, steady, and non-judgmental. Our words matter, but so does how we say them. A calm presence can help keep a visit grounded, and even if the topic is sensitive. One of the simplest but most powerful ways to prevent escalation is to set clear expectations right at the start of the visit. Begin by explaining why you're there and what you plan to do. For example, today I'm here to check on your recovery and review your medications. It should take about 30 minutes. That gives your client a mental roadmap for what is about to happen. Outline the time you expect to spend there. This helps clients prepare mentally and prevent frustration if they were expecting something quicker or more in depth. Clarify any boundaries. This might include where you'll be working in the home or letting them know about any safety or health protocols you'll be following. Before you start, give the client a chance to ask questions. Sometimes their concerns are small, but answering them up front can prevent bigger frustrations later. And finally, confirm they understand what's going to happen to them. It might seem like an extra step, but it ensures that you're starting on the same page, and that's key for keeping the visit running smoothly. A big part of keeping visits calm and productive is remembering not to make assumptions and always maintaining those professional boundaries. Never assume that you know exactly what a client needs, feels, or wants, even if you've worked with them for months or years. People's situations change, and the best way to know is to ask and truly listen to their response. Treat each visit like its own moment, even if you're familiar with the client. This helps to stay open to new information and prevent you from overlooking changes in their mood or circumstances. When it comes to sharing about yourself, keep it minimal and professional. A little personal connection can build rapport, but too much can blur the lines and shift focus away from the client. If you're ever invited into a situation that feels like it crosses professional boundaries, maybe they want you to join them for a social activity or take sides in a family dispute or accept gifts, just politely decline and redirect back to your role. And remember, your job is to support your client's goals, not to impose your personal opinion. This keeps the relationship healthy, respectful, and less likely to escalate into conflict. One of the best tools we have for preventing escalation is giving clients a sense of control. Even small choices like where to sit, what task to start with, and whether to talk first or do an assessment later can make someone feel respected and less defensive. Whenever possible, involve them in decision making. Use language that positions you as a partner rather than an authority figure. Simple phrases like, "Let's figure this out together," can go a long way towards building trust. Keep your voice calm and steady, even if emotions are running high. Your tone can either soothe a tense situation or unintentionally make it worse. It also helps to acknowledge what they're feeling. You don't have to agree with everything they say, but showing you hear them, for example, "I can see this is frustrating for you," can help lower those tensions. The more you approach visits with collaboration and calm communication, the less likely you are to see them spiral into conflict. And now we're going to move into recognizing red flags. Recognizing red flags early is one of the most important skills we can develop. It's what gives us a chance to respond before things escalate too far. Behavioral red flags are often the easiest to spot because they're visible and obvious, and they gradually build. For example, yelling or using hostile language is an immediate sign that someone's stress level is rising. Pacing or restlessness, especially if it's paired with rapid movements, can signal agitation. Tightened jaws or clenched fists or intense glaring are physical signs of tension that can precede aggressive behavior. And if someone starts ignoring boundaries, like moving closer when you've stepped back or steps into your personal space without invitation, that's another clear warning sign. And of course, verbal threats and ultimatums are major signals to take action, whether that's de-escalating, pausing the visit, or leaving. The earlier we notice these signs, the more options we have to keep the visit safe. Sometimes the red flags aren't coming from the client at all, they're coming from the environment around you. If you see weapons or dangerous objects within easy reach, whether that's a firearm, a knife, or even heavy tools, that should immediately raise your awareness. Aggressive or unrestrained pets, especially large dogs, can also change the tone of a visit very quickly. Be aware of the signs of substance use, like drug paraphernalia, strong odors, or open alcohol containers. These can indicate a higher risk for unpredictable behavior. Also look for evidence of recent conflict, like holes in the walls or broken furniture or shattered glass, which could mean that tensions in the home have been running pretty high. Crowded or unstable living conditions are another concern, especially if they block your access to a safe exit. And finally, take note if there are unfamiliar people in the home. Sometimes the biggest safety risk isn't the client you came to see, but someone else in the room whose behavior you don't know. The key is to take your surroundings take them in constantly so that you can decide if it's safe to stay or if you need to adjust your plan. Sometimes the most important red flags aren't physical or environmental. They're emotional or psychological. If a client suddenly becomes paranoid or starts talking about being watched, followed, or targeted, that may be a sign that they're experiencing acute distress, possibly from a psychotic episode or a psychiatric issue. Watch for rapid mood swings, going from calm to angry, tearful, or euphoric in minutes, especially if there's no obvious reason for the shift. Now, disorganized or incoherent speech or bouncing rapidly between unrelated topics can point to acute psychiatric symptoms, intoxication, or severe stress. On the other end of the spectrum, a flat or detached affect, where someone seems emotionally shut down, can signal depression, trauma response, or a mental health crisis. Expressions of hopelessness or worthlessness or thoughts of wanting to die must be taken seriously. Even if they seem offhanded or casual, they are a strong indicator that the visit may need to shift towards crisis intervention or immediate referral. Heightened fear or panic without a clear cause, or behavior suggesting a loss of contact with reality, such as hallucinations or delusions, means you should prioritize safety for both you and your client. The key is to notice these signs early and decide whether to slow down, shift to de-escalation, involve crisis resources, or exit the situation for everyone's safety. Once you know how to spot those red flags, behavioral, environmental, or psychological, the next step is deciding what to do about them. Sometimes the best move is to pause. If you notice someone starting to get agitated or the energy in the room is shifting, slow it down. Lower your voice, give them more space, and use your de-escalation skills to try to reset that tone. If the concerns are manageable but still present, you might adjust your plan. That could mean moving to a different part of the home where you have a clearer exit, bringing in another team member for support, or deciding to shorten the visit to avoid pushing tensions further. But there are also times when the safest and only choice is to exit. That's the case where someone makes a direct threat, if a weapon is visible or produced, if aggression becomes physical, or if your way out is being blocked. And here's the most important takeaway. You do not need to finish a visit if you feel unsafe. Safety isn't a bonus, it's the foundation of being able to do your job well. If that means leaving early, you can reschedule later or follow up through your agency, but you can't replace your own safety. Now we're going to move on to de-escalation basics. And we've touched on some of this previously, but we'll go into a smidge more depth. Before we can calm a situation, we have to recognize when it's starting to heat up. One of the first things I listen for is changes in voice. Maybe someone's getting louder, faster, sharper. That's often one of the earliest signs that stress is rising. Next is movement. Are they pacing, fidgeting, or is there a sudden burst of energy? It can be an outlet of frustration. But it can also lead to physical escalation if it becomes unchecked. I also watch for changes in language or facial expressions, maybe more hostility, more tension around the eyes or the mouth, or the words are becoming more aggressive. And if someone starts refusing boundaries or ignoring earlier agreements, that's a signal that they may be losing patience or trust. And physical tension is another big cue. So those clenched fists, rigid posture, shoulders are pulled back and tight. Those are often precursors to physical outbursts. And finally, when a client starts repeating the same grievance louder and more frequently, It's a sign that they're getting stuck in frustration, and that's when it's time to step in with some de-escalation strategies. Now, as we know, when emotions start running high, the way that we speak can either calm things down or make them much worse. First, keep your tone calm and steady. Even if that client's voice keeps getting louder and louder, resist the urge to match their volume. Your calmness can bring their energy down. Use short and clear sentences when someone is upset. They do not have the ability to process long explanations or a lot of words. Give information in small, easy to understand pieces. You also want to acknowledge their feelings without endorsing harmful behavior. A simple phrase like, "I can see this is frustrating for you," again shows empathy while still holding those boundaries. Whenever possible, you want to offer those options. So give people a choice and a sense of control, and that can reduce their need to push back or have that escalated behavior. And depending on the client, it's kind of always good to know up front, avoid sarcasm until you really know someone. Avoid judgment or debating facts in the heat of the moment. This almost always makes things worse. And use we language instead of you statements whenever possible. Saying things like, "Let's work on this together," or "We can do this." Communicate that you're on the same team, which can help shift the dynamic away from conflict. While our words are very important, how we also position our physical body can make a huge difference in keeping the situation safe. Whenever possible, keep 2 arms lengths between you and your client. And I know that when you're providing close quarters care, that's not always an option, but whenever possible, whenever there's time for space, give that space. It gives you enough reaction time if something happens, and it can also make your client feel less crowded. Position yourself so that you can also exit clearly, see the exit without making it obvious that you're planning a quick escape. It should just be a part of your natural awareness. Also, standing at an angle instead of directly face to face can make clients feel less defensive, less confrontational, and more conversational. You also want to keep your hands visible and relaxed. Hidden hands can actually make people very uneasy, and clenched fists can also signal to your client unintentionally that you're feeling tension. You also want to make sure you're not cornering your client or blocking their movement. If they feel trapped, that can escalate things faster. And finally, keep mental track of anything in the space that could get between you and the exit, whether it's furniture, clutter, or another person. One of the fastest ways to make a situation worse is to get pulled into a power struggle. When we start focusing on proving a point or winning the conversation, a client often digs in deeper and we end up with more conflict instead of progress. Instead, approach the situation with curiosity. Try to understand what's behind their reaction. Simple questions like, "Can you help me understand what's most important to you right now?" can shift the tone from confrontation to collaboration. You can also use empathy to acknowledge their feelings, for example. I can see that this situation is upsetting, but without committing to anything unsafe or unrealistic. When you can find small areas of agreement, it could be as simple as, "We both want to make sure that you get the support you need." That helps to build trust and lower defenses. And finally, keep redirecting the conversation towards shared goals and next steps instead of getting stuck in the problem. That forward focus helps the client to see there's a path to resolution without a fight. Sometimes, despite our best prevention and de-escalation skills, a situation becomes unsafe, and that's when we need to act quickly. We end the visit or call for help immediately if verbal or physical threats are made towards you or anyone else in the home. If you see a weapon, whether it's in someone's hand or just suddenly appears in the room, treat it as an immediate danger signal. Physical aggression, pushing, blocking your movement, and hitting are clear signs it's time to leave. If you realize your exit route is blocked, either physically or by someone's presence, that's another red flag to act fast. We also need to consider situations where a client may be in a medical or psychiatric crisis that requires immediate intervention, such as severe injury, unresponsiveness, suicidal statements, or extreme agitation. And remember, you don't need a checklist to justify leaving. If something doesn't feel safe, trust your instincts. Your safety always comes first. Now we're going to transition into emergency response. Every home health agency should have an emergency protocol, and these can look very different from one organization to the next. That's why it's important to become familiar with your agency's procedures before you ever need them. If you notice your agency's protocol is missing important steps like who to call if your supervisor can't be reached, or how to safely check out of a visit, speak up and advocate for those changes. The time to fix a gap is before it's tested in the real world. If a crisis happens, your first priority is to remove yourself from danger. Once you're in a safe location, call 911 if there's a threat of violence, a medical emergency, or any situation where immediate assistance is needed. When you speak to the dispatcher, be ready to give your name and role, the exact address and cross streets, and a clear description of what's happening, including whether weapons, aggressive individuals, or a medical crisis is involved. After that, notify your supervisor or designated contact as soon as it's safe to do so. And finally, document the incident according to your agency's reporting guidelines while the details are still fresh in your mind. Preparation and familiarity with your agency's plan will help you act quickly, calmly, and effectively in an emergency. I want to emphasize something that's easy to forget when you're focused on helping clients. Your safety is always more important than finishing the visit. If a situation becomes unsafe, even if you're mid-sentence or halfway through a task, it's okay to stop right then. You can reschedule or follow up later when things are stable, but you can't undo harm if it happens. No chart note, medication review, or service completion is worth putting yourself in danger. And while it's natural to want to push through for the sake of the client, the reality is that you can't help them effectively if you've been harmed or traumatized. Trust your instincts. If something feels wrong, act immediately. Leave the environment, call for help, and regroup once you know it's safe. When you already know a client or environment has higher than usual risks, its best approach is to plan ahead and layer in extra safety steps. Paired visits are one of the most effective tools. Having 2 staff members present not only increases safety, but it also provides support if something unexpected happens. For newer staff, pairing with somebody experienced is especially valuable. You also want to coordinate with other team members. If a nurse or a therapist is scheduled to visit, try to align your timing so you're there together or back to back. In higher risk cases, joint visits should be the standard, not the exception. Also use check-in systems, touching base before and after visits with your supervisor or safety contact, and having a discrete code word for emergencies. Think about scheduling adjustments, for example, visiting only during daylight or avoiding times when certain household members who pose a risk are likely to be present. And finally, do proactive safety planning. Review known risks during team meetings, identify safe spaces or exits before you enter, and always have an emergency contact list ready. These steps take a little extra time, but they can make all the difference in preventing and responding to unsafe situations. Now we're going to talk about after an incident. Once you've removed yourself from danger and the immediate crisis has passed, the very next step is to report the incident. As soon as it's safe, notify your supervisor or designated safety contact. Keep your report clear and factual. Stick to what happened, not what you think might have happened. Be sure to include the date, time, location, the names of anybody involved, and exactly what actions you took before, during, and after the incident. Most agencies have an official reporting form or electronic process. Follow that so your documentation is consistent and legally sound. And here's something important. Report even near misses. If something could have become unsafe but didn't, that's valuable information. It can help prevent future incidents for you and your coworkers. An incident doesn't just end when you leave the scene. It can stay with you, especially if it was intense or frightening. That's why debriefing is so important. If your agency offers a critical incident debrief, take part. These sessions give you a chance to walk through what happened, get support, and think about what worked and what might be done differently next time. Use supervision as a safe space to talk openly about what happened. Your supervisor can help identify any patterns or risks or safety strategies to add moving forward. And don't underestimate the emotional toll an incident can have. Talk to trusted colleagues, friends, or professional mental health resources. Pay attention to any signs of stress or trauma, trouble sleeping, feeling on edge, replaying the event in your mind, and take them seriously. If you have access to an employee assistance program or counseling through your agency, use it. These services exist for moments like that. And finally, make time for self-care, whether it's exercise, rest, hobbies, or just taking a quiet moment. Your recovery matters. An incident doesn't just end when you leave the scene. It can stay with you, especially if it was intense or frightening. That's why debriefing is so important. If your agency offers a critical incident debrief, take part. These sessions give you a chance to walk through what happened, get support, and think about what worked and what might be done differently next time. Use supervision as a safe space to talk openly about what happened. Your supervisor can help identify any patterns or risks or safety strategies to add moving forward. And don't underestimate the emotional toll an incident can have. Talk to trusted colleagues, friends, or professional mental health resources. Pay attention to any signs of stress or trauma, trouble sleeping, feeling on edge, replaying the event in your mind, and take them seriously. If you have access to an employee assistance program or counseling through your agency, use it. These services exist for moments like that. And finally, make time for self-care, whether it's exercise, rest, hobbies, or just taking a quiet moment. Your recovery matters. Now, when we are learning from the incident and debriefing, every incident, whether it ended in a crisis or was just a close call, gives us valuable information that we can use to stay safer in the future. Start by reviewing what went well in your response, the things that you'd want to do again, because they kept you safe and helped calm the situation. Then look at the moments where a different approach might have made the situation safer or improved the outcome. This isn't about blame, it's all about learning. Share your lessons learned with your team and your colleagues. The more we talk about what works and what doesn't, the stronger our safety culture becomes. Use what you've learned to update your personal safety checklists or habits. Maybe there's something new you want to look into before entering a home, or a phrase you found works well in de-escalation. Share those with your colleagues. And if you spot gaps in your agency's protocols during your review, recommend changes. Protocols are living documents, and they're only as strong as the real world situations that they prepare us for. The bottom line, every experience, even a tough one, can help us get better at preventing and managing risks in the future. Now we're going to move into a few special considerations for different populations you may be encountering. When working with clients who have dementia, they often require a different approach to keep the visit safe and comfortable. Start by approaching slowly and from the front so you don't startle them. Sudden movements or appearing from behind can cause confusion or even fear. Use short, simple sentences and give one instruction at a time. For example, instead of saying, "Let's go into the kitchen and take your medication before we sit down for lunch," break that into smaller steps. Maintain some gentle eye contact and a calm tone. It's not just what you say, but it's how you say it that helps them feel at ease. Be patient. It might take extra time for them to process what you've said or respond. And if they say something that isn't correct, avoid arguing or confronting. Redirect gently towards the next step instead. And watch closely for signs of fear, confusion, or agitation. Address them early. A small calming gesture now can prevent a bigger issue later on in the visit. Clients with psychiatric needs can have a wide range of experiences with healthcare professionals, and our approach can make the difference between a smooth visit and a tense one. Start by building rapport before diving into sensitive topics. A few minutes of light conversation or checking in on something they care about can set a positive tone. Pay attention to those early warning signs that they may be headed into distress, like pacing, sudden silence, or change in voice or expression. Avoid making sudden changes in your tone, the topic of conversation, or even the physical environment. Predictability helps clients feel secure. Always use language that is clear, respectful, and free from judgment. For example, instead of "you're overreacting," try, "I can see this is really important to you. Let's talk through it." Set boundaries in a calm and consistent way. If you need to redirect, do so with kindness but firmness. And if acute symptoms appear, like paranoia, hallucination, or severe agitation, shift your priority to safety and support. That might mean slowing down, giving space, or involving a crisis resource if needed. When working with clients who may be using substances, the most important thing is to assess the situation before you even step inside. If you see or suspect intoxication, slurred speech, unsteady movement, strong odors, think about whether it's safe to proceed. Sometimes the safest option is to reschedule. If you do move forward, keep the conversation calm, clear, and non-confrontational. Challenging someone about their substance use in the moment usually increases tension. Never approach or attempt to dispose of any substances or paraphernalia. It's not safe and it's outside of the scope of your role. Remember that someone under the influence can shift quickly. Their mood, coordination, or judgment may change without warning. And as always, prioritize safety over completing a visit. If the situation feels unsafe for you or the client, it's okay to stop and return another time. Now, in our role, we work with people from all different backgrounds and cultures, and cultural awareness is very important. It isn't just about being polite. It's about creating safety, trust, and effective communication. Take time to learn about the cultural norms of the communities you serve. Even small differences like how people greet one another or how to express emotions can impact how your visit is received. Use respectful, inclusive language and avoid slang or jargon that might confuse or alienate them. Ask about and honor your client's preferences. That could include how they'd like to be addressed, which pronouns they use, or how they prefer to communicate. Be mindful of body language, gestures, and ideas about personal space as they vary across cultures. What feels warm and friendly to you might feel intrusive to someone else. If translation is needed, use a professional interpreter rather than a family member to ensure accuracy and privacy. And above all, avoid making assumptions. Let the client's own words and priorities guide what matters most during the visit. Now, to keep ourselves safe in the field, we need more than just good instincts. We need clear, consistent processes that everyone follows. Starting with scheduling and communication, these are recommendations that I have that I've seen best practices along the way. Keep your Outlook or shared calendar updated with the client's full information, including address, phone number, and any special instructions. Always use a check-in, check-out system so someone knows when you're arriving, when you leave, and share any schedule changes right away. When planning visits, review the client's history, any recent incidents, confirm in advance that pets will be secured, and that any other known safety issues are addressed. If possible, schedule higher risk visits during daylight hours. In the field, carrying a fully charged phone, park in a safe, well-lit area facing out for an easy exit, and keep your keys and any other safety tools on you, not buried in a bag. Always have a clear plan for what you do if you feel unsafe. Include where you'll go and how you'll get there. And at the agency level, take part in regular safety debriefings, pair up for high-risk visits, and use code words for discrete signals to get help if needed. And remember, document any concerns or incidents right away so that they can be addressed and learned from. And as we come to a close, I just had a few more things, a few wrap up and key points. So I want to bring it all together. Remember, your safety is always first priority. Every decision you make should flow from that. Preparation is your best defense, and it starts before you even arrive at your visit. While you're there, stay aware, pay attention to behavior, the environment, and any emotional shifts. Use prevention and de-escalation strategies early to keep situations from escalating higher. And if things start to move towards danger, know when to pause, adjust, or exit, and trust your instincts. If an incident occurs, follow your agency's emergency and reporting protocols. They exist to protect you and your clients. And finally, take care of yourself after an incident. Debrief, learn from the experience, and give yourself space to recover. And thank you so much for your time today.